You can find them in the most outlandish places doing many different activities. Hospitals, research laboratories, clinics, universities and veterinarian offices, even the local grocer. I'm a little taller, a little lankier, and a very distant, almost relative to the greatest one that ever lived. Join us this week for another amazing episode of The Pharmacist Hunter. Today, we'll be trying to observe more pharmacists in action, which can be difficult. They are wily little creatures, and you must use your stealth in order to quietly observe them in one of their many natural habitats. Now, contrary to popular thought, pharmies, as I like to call them, are not just found in the local pharmacy putting pills into bottles. Oh, look, there's one of the little buggers now. As you can see, pharmies interact well with others and are highly social. Here at the hospital, they have no trouble contributing, collaborating, sharing their opinions, but are not overly aggressive. They tend to be caregivers and are highly respected by patients and healthcare professionals for their expert knowledge of medications, especially when it comes to dosing, side effects, interactions, and over-the-counter drugs. They are in so many different hospital environments, you have to be very careful when sneaking up on them. We tracked one down here, working with little game in the neonatal department. We observed this pharmy sussing out a delicate situation in a very nurturing way, and then providing an effective remedy for this little creature. We tracked another one soon after leaving the Mammoth Hospital and ended up here in a small classroom where a pharmy is educating others about quitting smoking. Wow, they really are natural-born communicators and teachers, highly interactive and intelligent. There really seems to be a modest, universal confidence to them. We found one later at a neighborhood pharmacy. This pharmy has given a number of flu shots today and is about to give another one. They even give the shot in private. Ouch! I don't personally care for needles. We observed this pharmy assuring this patient that a little pain is a small price to pay for a lot of protection. She also told these people how many lives are saved with vaccination programs. Blimey, that was close. Sneaking up on these creatures is ever so difficult. They're highly aware of their surroundings and can spot a patient in need from far away. So we better vacate. Whether it be collaborating with new technology to determine patient drug levels in clinical trials, or coordinating with colleagues to ensure patients are adhering to drug regimens, pharmies can always adapt to their environment and surroundings. In fact, ecosystems where they are present are consistently healthier and safer than those where pharmies are absent. Often cuddly little creatures, their cuteness can be disarming, but don't let it fool you. These little buggers are essential to the smooth operating of a health-related ecosystem. They thrive in fast-paced, complex environments, and they're not afraid to challenge the most fearsome illnesses. And as we've seen, they're everywhere. Crikey! She spotted me. We'll be needing to leave. One last question. Do you have what it takes to be a pharmacist?